Now, the National Taxpayers Association, NTA, is calling for an increase in taxes on tobacco products to reduce cigarette use among the youth and Kenyans in general. NTA says cigarette smoking has serious health effects on users and ultimately affects the productivity of a population. Our reporter Sarafina Robi met with 27-year-old David Kulam, a recovered smoker, and now highlights the effects smoking has on the youth and the general public.
By the Center for Disease Control and Prevention shows that 9 out of 10 cigarette smokers begin smoking before the age of 18 and 99% do so by the age of 26. But in Kenya, the situation is dire.
The new generation products, the age of initiation starts at 7 years. That is a grade 1 student. So if this grade 1 student is addicted to these things that parents do not recognize, they think they are parents, what does that mean to the quality of a human capital as a country?
Tobacco inaadhiri vijana sana. Juu unapata kama kijana wa standard 4, 5 anavuta sigara.
This is the case for 27-year-old David Kulam, we meet at the KBC Youth Unite Against Crime Center.
Nilianza sigara nikiwa form 1. Hapo ilikuwa 2011 hapo. Nikavuta mpaka 2017 hapo. Tukismoke fegi na profit haiko gat na kaida za to affect. Na tu bestanga akivuta pia mimi kama nivute moshi mbili. Hiyo fegi ilifanya mpaka nikakuwa nimeconcentrate sana na kitu kama drug sana sababu ya kusmoke. Sasa chuo iko ngena nibamba sana.
A medical alarm from the doctor will force him to reconsider his choices.
Aliniambia naniletea shida ya kifua na nikiendelea kuvuta hivyo atanaweza niletea sijini inaitwa lungs failure ama sijini nini. Anasema bado age yako ni ndogo ufai kuvuta fegi atiwa kama mzee.
It has cost him and his family.
Nilikuwa narudi kwa paro wangu. Madangu sasa alikuwa anauza hata asset nyumbani, yani mali yako naye anasema ndio niende ni mtibiwe ni chekana za recover sababu alikuwa ananiishia. Aliuza kitu kama ng'ombe, vitu biashara yake karudi chini juu kunibaya madawa.
Rashid Fadhili, the founder of Kibra Youth Unite Against Crime Center, is at pains explaining the effects tobacco products have had on the youths.
Ni watu wenye tunapata $1 a day, mili yetu. Sasa kuna venye unaweza sema ati hata ukiadhirika sana, ati utaenda National, hizi Nairobi Hospital, Aga Khan, huwezi enda. Obviously ugonjwa ikikupiga, either pengine Mungu akunusuru ubaki ama tunakuzika.
His sentiments have been echoed by the National Taxpayers Association.
Most of the people who are able to access the new generation product are at the age of between 15 to 30. And the main reason is they associate these products to class. They feel that if you're able to access such products, one, because the marketing, they are packaged in fancy and good-looking packets. The labeling is not as equivalent to the traditional ones.
They now want the government to relook at the Tobacco Control Act.
Nicotine is the active ingredient also in the tobacco products. So we feel that this is kind of splitting hairs, but to be able to address that concern from the industry, then it's good that we review that law to see does it cover that.
The National Taxpayers Association believes that a unified tax system in Kenya would ultimately reduce the affordability of the product.
Best practice is that we should have 70% of the retail price of this product constituting tax, excise tax, which has not been the case. So again, that is an area we are keen and is a policy area that we urge the government to look closely. Again, there is also another provision in our law, which is now the Solation Fund. Solation Fund is basically a compensatory fund, which is about, for Kenya, it's 2% of earnings by the tobacco industry. So we also urge the government to, because the fund is ring-fenced and is supposed to support the health sector, so we want all this to be implemented in full.
Tobacco use harms nearly every part of the body and is associated with arthritis, bone complications, diabetes, cancer, heart disease, respiratory diseases, childhood diseases, which statistically records between 30 to 40% prevalence rates among the users. According to the National Taxpayers Association, tobacco kills nearly 6 million people every year, and without control, tobacco is projected to kill more than 8 million people a year worldwide by 2030. 80% of these premature deaths occurring among people in low and middle-income countries. NTA now hopes the government will consider their plea and protect the youth against such deaths. Sarafina Robi for Easy Friday.